Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back. We are talking about scoliosis, which affects the spine and can cause deformities and complications if left untreated. Let's now get to some of our viewer questions. Doc Frank from Jigo asks, if my son has a mild curve in his spine, should I be worried?
Well, it kind of depends on the age of your child, Frank. If he's a baby, like under 5 years old, then definitely it should be something checked out. That's quite unusual to be born with a curvature, but it can happen. Most often it's children between, let's say, 5 and 10, and then you would do the things we talked about as far as good posture and exercise and monitoring, and you'd take your child in maybe once a year to get an x-ray of the spine to see how well that back is growing.
Okay. Joseph from Barragata asks, what kinds of exercise is safe for someone with scoliosis? And I think you mentioned earlier swimming.
Yeah, swimming. Swimming is excellent because there's no load on your body. You're floating, yet you're using your muscles, which is really important to keep muscles strong. Other exercises, I guess exercises to avoid would be something like weightlifting or really high impact activities. But most other gentle forms of exercise, walking, running, biking, these would be all appropriate.
Yoga, Pilates,
yoga,
like
but not the back bends, going backwards, yeah.
Because that can aggravate it?
That could aggravate it, yeah.
Okay. Rita from Enarahan asks, why is scoliosis more prevalent in women?
And that's a great question. I don't know if anyone knows the answer to that. Scoliosis actually affects men and women, or boys and girls equally, but it's much more severe in girls. Somehow during their growth spurt, maybe their growth spurt is faster, but somehow during their growth spurt they will get more deformity than the boys will. A ratio about 1.5 to 1, so a little bit worse in girls.
Okay, so their pain seems to be more than of the men.
Not necessarily the pain, but their level
Deformity.
of curvature, their level of deformity.
Okay. Selena from Dededo asks, are there certain activities I should stay away from because I have this disorder?
Maybe just weightlifting and the yoga back bends that we talked about. Other activities, carrying heavy loads, that would not be good for you at all. Avoiding heavy loads both on your back and just carrying things. Try to use either a cart or some sort of assistance.
Okay. And Christina from Maina asks, I have chronic back pain. Should I get checked for scoliosis?
I'm guessing you're an adult, and in that case, by now that should have probably been diagnosed, but most back pain is not due to a sideways deformity like with scoliosis. It's due to wear and tear, maybe poor posture, maybe slip discs, many other reasons. So if you're an adult with back pain and you've never had problems since childhood, it's probably not scoliosis.
Okay. You were mentioning earlier simple tests for parents. So just have your kids between 5 and 10, you said?
Yeah, well, and we screen them when there's school physicals, so between ages 5 right up until they're done growing, around 16 or so. But simple thing to do, just have them lean forward and look at their spine, see if it's straight. Another thing that sometimes causes curvature, besides the posture that we talked about, is a leg length deformity, where when the child has one leg that's just a little bit longer than the other leg, so they're always kind of shifting, carrying themselves just a little off, and that can also contribute to not a straight spine. So that's another thing that you can check on your child.
Now, I've heard of going to the chiropractor. Does a chiropractor help somebody with scoliosis?
I'm not really familiar with what they would do. It's possible that they could help. The thing is that you can only help scoliosis while the child is still growing. Once the growth is complete, there's really nothing much you can do. It's a fixed problem. And that's why all the interventions are done hopefully very early along.
Okay. And one last thing I wanted to drive home was, kids nowadays have so many books, bulky books, and so I see kids getting off the bus, and I mean, it really looks heavy. Yeah. And so, maybe parents should be a little bit cautious and concerned about that. That obviously goes to the posture of a child and can affect the scoliosis.
Yeah, and it's recommended that your child carry no more than 15, maybe maximum 20% of their body weight in books on their backpack. So you can weigh your child and do the math. Basically, if 1/5 of their weight is being carried on their back, that's too much already. And speaking to the teachers about what can be done as far as either sharing the books or photocopying or whatever, that would be helpful.
Okay, any last words of advice out there for our viewers about their having their kids checked and for scoliosis?
For scoliosis. It's just a simple thing to screen for. Most often, no treatment's required, but it's something that should be monitored. And you can also teach your children to sit straight with their back up.
Something I need to work on is my posture.
Yeah, especially because these days everybody's hunched over computers, and doing their little Game Boys and all of that. So we tend and slouched on comfy cushions and couches. So trying to sit straight is really important.
That's a good thing about these chairs. They force us to have good posture.
Yeah.
Thanks, Doc, again for coming in. Our